have completed till question number 8, the last day, isn't it? With a female patient with cholelithiasis, with stones in the GP duct. That was our case. You all remember? That was the last case that we had discussed. And the second one we had discussed was someone with a peptic ulcer surgery who had palpitation, tachycardia, lightheadedness, and diaphoresis after a meal. All of you remember? Yes, question number 9. That was question number 9. So we've done till there. So today we proceed from question number 10. I'm audible to everyone, I hope. Ankita, can we have the question on the screen, please? Ankita, can we have the question on the screen? Okay. There we have the question there on the screen. And a 19-year-old college student was admitted with vomiting, diarrhea, and colic in the umbilical region after dining out in a Chinese restaurant the night before. Plan a diet for her. So, what is the main clue for us in this particular question? That this patient has dined out in a Chinese restaurant the night before. So basically, this patient has some form of gastrointestinal poisoning or food poisoning. Now, what is the commonest food poisoning reaction that we see when eating at Chinese restaurant? Does anybody know the name of the causative agent? Gluten sensitive enteropathy? No, gluten is not there in Chinese restaurant. Is mostly gluten enteropathy is something we don't think about when we're talking about Chinese restaurant. Gluten enteropathy would be associated to your bakery products. Monosodium glutamate, it does not cause food poisoning. The monosodium glutamate can cause an severe allergic reaction. That can also be gastrointestinal allergy. That's not Ajinomoto, that's Ajinomoto or monosodium glutamate. Seafood allergy, no. There is one particular causative organism which is found in Chinese restaurant, especially it comes from fried rice which has been kept for a long time. Salmonella is possible, but I'm not ruling out salmonella. Basically because yes, it has been, but salmonella poisoning usually takes place within 4 hours. This states that she had had the night before, and in the next morning she's having vomiting, diarrhea, and colic. So, what is the causative agent? Can anybody take a wild guess? No, it's not E. coli. E. coli only comes to your food when there is some kind of fecal contamination. So we are giving this much of providence to the restaurant that it is basically the standard of hygienes is good. So we rule out E. coli in that matter because E. coli, as I will once again reinstate, comes through any kind of fecal contamination of food. Okay. Well, the causative organism here is Bacillus cereus. Please write it down. Bacillus cereus. Sirissus. Bacillus cereus. These are the symptoms of Chinese restaurant. Whenever you hear the name Chinese restaurant, look out for the microorganism Bacillus cereus and the signature discomforts that the patient will encounter after an infection with Bacillus cereus is vomiting, diarrhea, colic in the umbilical region. So basically, this patient requires nothing much of a dietary interventions as such, other than, in the initial period, the patient should not be given anything other than ORS and be given antimicrobial agents. You can, after a little while, add on to some prebiotics to the patient's food. Now, what is prebiotic and what is probiotic? Can somebody unmute themselves and tell me what is prebiotic and what is probiotic? Anybody?
Ma'am, probiotics are like lactobacillus, which are basically helping in growing intestinal flora, and prebiotics are something which will help in amassing bacterial flora. Like it could be fiber food or fermented food, which will.
Okay, so she's pretty close. Probiotics are the actual living organisms. Okay, and prebiotics are the substrate maybe on which these living organisms thrive. So the probiotics will be the living organisms themselves, while prebiotics will be the substrate on which these living organisms will thrive. So this is the difference between probiotics and prebiotics. Is this clear to everybody? So here what I could do is I could give some curd to the patient a little while later, because that's a good source of probiotics. What probiotics do I found in curd? Do I find in curd? Lactobacillus. What's the strain? Lactobacillus acidophilus. Okay. So in curd I normally find Lactobacillus acidophilus. Am I clear in this part? Then that this patient needs to be given lots of fluids, because she's having diarrhea which and vomiting, which means she's losing fluids, she's losing electrolytes, she is also losing zinc. So the WHO recommended ORS would be ideal for her. And alongside, she can be given fluids which has lots of electrolyte in it. For example, Dove water can be used for her. We can use tomato soup for her. And later on, I would like to give her a thin buttermilk, not lassi, not the thickened one, not with added sugar. Why not added sugar? Because I don't want added fermentation of sucrose in the diet, in her stomach. Therefore, I do not give any added sugar to the patient. So this is more or less how we go about for planning this patient's diet. And after the liquid diet, slowly we wean her to full fluid, and then finally to a bland diet. And that's it. This would be a diet intervention requirement for at the most 3 to 4 days if it is a normal case of Bacillus cereus. Am I clear to everybody? Any queries on this one? Anybody? Ankita, how many are supposed to be there in today's class?
Ma'am, I don't know the total number. The information is given by Shweta. She might be able to say that. But
Doesn't seem quite many this today.
23 of
Normally
them.
there are around 20. Normally there are around 40, I believe.
Yes, ma'am.
Anyway. Okay, so I believe you're all clear with this one. We'll go, because we have lots of questions to discuss, so we'll go a little fast. And now that you're slowly getting a hang of it. Acha, by the way, any of you out here, is there anybody who doesn't know how to actually prepare a diet chart? I mean, I've been hearing a few interns saying that they are not able to plan a basic diet chart. Is there anybody out here who does not know how to plan a diet chart? ম্যাম আমাকে প্রিবায়োটিক্স আচ্ছা আরেকবার বুঝতে বলবেন ইয়া বলছি Srilekha, you don't know how to plan a diet chart? I don't know how to plan. Srilekha, you don't know how to write a diet chart? Okay, that's sad. Acha, I'll explain in quickly how to make a diet chart. First comes your aims and objectives. No, there is no calorie. Not a question of there is no question of calorie reduction and inclusion out here. You're putting the patient on a clear liquid diet. How much of calories can you give from a clear liquid diet? It is all a clear liquid diet is basically aimed to correct any dehydration condition and to correct any electrolyte imbalance that is happening in the bodies. The clear liquid diet does not take into account much of the requirement of the proximate principles being protein, fat, and calories. It is mainly given to correct the dehydration and the electrolyte imbalance. So calories are not of a concern. Even when we add lactobacillus to the diet, even then we are not actually concerned about the calorie content of the diet. It is basically developing the good intestinal flora. It is basically helping the brush border enzymes to to populate. That is the main aim. And then slowly we get back to a bland diet. There also we do not give a high calorie or low. We just give the normal RDA requirements. There is no need for this patient to have anything other than RDA requirements. What we do is we remove green leafy vegetables and any kind of food which has too much of coarse fiber in it, because at this point of time we do not want to make the patient's already overworked stomach work more. And if you remember, we already explained in one of the classes that what green leafy vegetable does is it absorbs water and it swells up and it fills up half of the stomach. So, very less amount of calories. ক্যালোরি রিডাকশন কেন করবে এটা আমি তো সেটাই বুঝতে পারছি না why do you want to reduce calorie for this patient? This patient does not require a calorie reduction. If anything, this patient would require a little bit of calorie dense food, because you not because he's having heavy diarrhea, the transit time is very high. So you want to give simple food to the simply digestible food to this patient and remove coarse fibers from his or her diet so that it does not tax the stomach any further. There is no question of calorie reduction for this patient at all. And there is no question, and there is no need for increasing the calorie or protein or fat or any of the other proximate principles for this patient. The only thing that is need to be taken into account for this patient is we need to correct the dehydration status and correct the electrolyte status. Both of this can be achieved by giving adequate amount of WHO ORS. You can give other fluids also which are rich in electrolytes, like I said, dove water, tomato juice, orange juice. Such things can be given to the patient. And you can add some thin lassi, not lassi, buttermilk, chas to this patient to add some prebiotics to the diet. Other than that, you also get prebiotics. Yes, no dietary RDA modification is required for this patient. Only we remove the coarse fibers, because coarse fibers will absorb water, will swell up in the stomach, and will reduce the further reduce the tendencies of the further reduce the capacity of the patient to eat, which we don't want. So we do not give coarse fibers or any kind of food which is going to tax the digestive status of this patient. We give him foods which can be easily digested, but which also does not mean you have to give this patient oligomeric or monomeric formula foods. Just normal foods that can be easily digested. One thing you might want to remove from diet along with fiber is milk in its normal form. Many a times we find that if any kind of infection is happening to a patient, uh, lactase enzyme is often affected, and therefore, to be on the safe side, we remove milk in its form, but we do use milk products like curd. If you want to use, you can use chena. That's not a problem. We do not give milk for a week or so, just to be on the safer side. Now, that is all that there is to this particular diet. There is nothing more to it. Is this clear to everybody? Okay, going ahead with the next question. Oh, somebody said prebiotics and probiotics. Prebiotics হচ্ছে সেইটা যেটার মধ্যে probiotics বাঁচে. Probiotics is actually the organisms which help us to colonize the bacteria, to colonize the gut with friendly bacteria, or the organisms which colonize the gut, and these are friendly organisms, while prebiotics is a substrate on which these organisms thrive or eat. অর্থাৎ যেটা খায় সেটা হচ্ছে প্রিবায়োটিক্স, আর যে খায় সে হচ্ছে প্রোবায়োটিক। বোঝা গেছে? যে খায় সে প্রোবায়োটিক, যে অর্গানিজমটা খাচ্ছে সেই অর্গানিজমটাকে প্রোবায়োটিক বলা হয়, আর যেটা খাচ্ছে সেটাকে প্রিবায়োটিক বলা হয়। Okay, next question. A 25-year-old presents with jaundice since last 2 weeks. She has a history of chronic headache with bone ache, and she took an overdose, কথাটা তোমাদের ওখানে লেখা নেই, overdose of paracetamol tablets regularly for 6 months. LFT shows hyperbilirubinemia. HBsAg is negative. HBsAg is the sign for, is the test for, who can tell me? HBsAg is the test for hepatitis B. Very good. Huh? Somebody has any other answer than hepatitis B? Okay, this is for hepatitis B. Along with this, the patient is also diabetic. Now, one thing is, a 25-year-old girl being diabetic is of a little worry. She is one of those young adults who are diabetic, but currently we will not be thinking about that. Can anybody tell me why she has hyperbilirubinemia? What has been told us? Right, NSAID induced hepatic toxicity, and the NSAID here is,
Non-steroid anti-inflammatory drugs.
which is the NSAID in non-steroidal paracetamol, right? So it is basically the overdose of paracetamol. Now, can someone tell me what is the upper limit of paracetamol daily for an individual? Can anybody tell me what is
400
orally? Yes, 400 milligrams orally or 4 grams orally. It is basically 3 grams. Somebody can take it up to 4 grams. And what will be the toxic level? What will be the toxic level? 9 grams daily would be the toxic level. No, is maximum. Yeah, somebody has already answered that. 9 gram daily would be the toxic level. Okay. So here basically the hyperbilirubinemia will sort itself out as soon as she stops this paracetamol, and LFT otherwise does not show much of an affection. So we do not need to bother much about a hepatic condition out here. We can just plan a diet for I'm hoping she's 25-year-old, which means she is an active individual. So what we can do is we can find out try and see what is the chronic headache and body ache for. Does she have fever along with this? Is this a case of chronic hepatitis, chronic tuberculosis? Those are the things that we should look into. Does she have a chronic cough with this? Has she been losing weight, etc.? And her diabetic, whether her diabetes is under control, what is a regular sugar level? Those are the things that comes into this question is more of a heading, red heading, which means that they show you something but the actual story is about something else. So here basically we start concentrating on her diabetic thing, and also we try to find out if she's lost weight, she'd had chronic cough, and all of these. This would give us more insight to her medical condition. And paracetamol, this hyperbilirubinemia that she's currently suffering from, is basically paracetamol induced, that is clearly noted in this question. Therefore, we are not much concerned about the hepatic health. Normal diet is to be given, bearing diabetes in mind, but not too much of resistant starch right now, because she has hyperbilirubinemia. So there will be tendency of nausea and vomiting. So that taking into account, not too much of resistant starch in form of pulses and legumes. And we must actually develop liaison with the doctor to find out why she's having chronic headache and body ache for which she's having it. Is this because of Stress, maybe she's just 25-year old, there may be work related problems. She might be having migraine for which she requires medication. uh, it is just had it just been headache, we would have also thought of an ophthalmological problem. But since there is also body ache alongside, which makes me wonder whether she was also been getting low grade fever, especially night fever, which would be indicative of tuberculosis. And if she's 25 years old, tuberculosis is actually very common a finding in the Indian scenario for 25-year-old girls who are having chronic headache and body ache, malaise, less interest to do work. There might be a continuous cough for the last 3 weeks. It might be productive cough. It might be a non-productive cough. Whether she has been having low-grade fever. These are the differential diagnosis that comes to our mind.
Ma'am,
Supriya, do you want to add something to it?
this may be a case of provisional diagnosis. This may be a case of intestinal tuberculosis because hyperbilirubinemia along with malaise and headache. So I have to investigate at first LFT liver function test along with
So you have to investigate at first what?
because CRP level, C-reactive protein level is above 6 or not.
You have to
C-reactive
investigate or you would not just CRP media, you have to do a complete blood count for the patient. You
complete
would
blood
suggest
count.
to see whether, even before CRP, whether the total count is elevated or not. CRP comes in later. First, you have to see whether the total count of this patient is elevated or not. If there is any kind of tubercular infection, then definitely there will be an elevation of the total count. Is that clear?
Uh, yes, ma'am. And also digital X-ray of chest is to be done, may be done.
Digital X-ray would be done for the patient if the patient has been complaining of cough. Other than that, we do not want to expose a patient to radiation just like that, even if it is for a fraction of a minute. But first, a complete history. This history of the patient is a little incomplete. We need to find out whether this patient have been having productive cough, if this patient has been losing weight, has had night chills and rigors, has had diurnal variations of temperature. These are one of few of the very important factors that needs to be taken into account before a diet chart could be provided, because we are not getting the complete diagnosis through this. So that will be the DD of the patient. Am I clear to everyone? Okay, now I'm going to the next one. I hope the previous one was clear to everybody. A 50-year-old postmenopausal primate with a history of irregular menses in the past is complaining about hot flashes, burning sensation of the feet, and polyarthalgia. Plan her diet. So basically, a 50-year-old primate with irregular menses in the past and complaining of hot flashes. So, what is the most probable diagnosis in this case?
DUB,
What is the most
Menopausal
dysfunction uterine
syndrome.
bleeding.
huh?
Dysfunction uterine bleeding. DUB is the provisional diagnosis.
What somebody just said menopausal. Somebody said
Menopausal syndrome, ma'am, it is. I'm sorry to
menopause.
inform
So
you very soon.
menopausal is not a syndrome per se. The lady is probably going through menopause,
Yeah,
right?
postmenopausal is
Yeah.
probably and because of calcium deficiency, because during that time what happens is calcium absorption gets reduced.
That
So
is the
that,
reason why you get hot flashes.
ma'am, this arthralgia, that is also possible, ma'am.
Huh?
Along with the hot flashes, she is also having arthralgia, polyarthralgia. That could be also one of the probabilities.
I want all of you to read the question when she is a post-menopausal primary, which means she has had menopause. So now she is having hormonal imbalance and she requires an hormonal replacement therapy. So along with the pharmacological hormonal replacement, along with the hormonal replacement therapy pharmacological, you can also add on to phytogenic hormones, like there are lots of soya protein hormones which give you phytoestrogens, and lots of supplementary formulas which gives you phytoestrogens. So this is basically a lady who would require lots of phytoestrogens in her diet, which comes from various soya protein formulas. There are lots of there are formulations like Menopro, which is a rich phytoestrogen formula, and in along with phytoestrogen, as somebody was mentioning about calcium, she would require vitamin D and calcium supplementation in her diet. She would require vitamin E supplementation in her diet. All of these, and she would also start requiring antioxidant in her diet, added amount of antioxidants in her diet, because slowly she would be succumbing to these with the imbalance of hormones. There is always a chances of some form of malignant tissues slowly developing somewhere, breast malignancies and ovarian malignancies and uterine malignancies sometimes are seen. Though, of course, I'm not saying they will be seen, but once there is an hormonal imbalance in the body, these are the common malignancies that one starts encountering in the patient. So basically, the patient, and with hormonal deficiency, the patient start having weaker bones. So the problems of fracture femur, etc. Fractures of various long bones, especially, and hip fractures becomes very common for the patient. And aesthetically speaking, her skin starts showing lines, wrinkles. That is the reason why I said vitamin E is to be incorporated in her diet. Now, let us quickly see what are the sources of vitamin E. We basically know that various kinds of brands, BRAN, cereal brands are a good source of vitamin E. Various kinds of mixed seeds like chia seeds, like there are so many other kinds of seeds that you have, this superfood seeds, the flax seeds and the pumpkin seeds, all these seeds that you get, chia, flax, pumpkin, sesame, all these seeds, even poppy seeds, posto is a very good source of vitamin E. And these seeds also come with some amount of phytoestrogen. So though one of the largest source of phytoestrogen is soya bean, and so we can start including tofus and all that in her diet, and ask her to regularly exercise, to not lead a very sedentary lifestyle. Other than that, to live a moderately active lifestyle, to go for walks. This time we would request her to go for a walk in the morning, early sun, so that she can get adequate amount of vitamin D from the sun rays. We normally sometimes tell patient to go for evening walks, but for such patients we would suggest a morning walk. Carbohydrates out here, because she's having hot flashes and all that, simple carbohydrates have a tendency to cause water accumulation. So we give complex carbohydrates out here. But please, once again, complex carbohydrate does not only mean lots and lots and lots of roughage. No, they would mean both complex in the form of soluble and insoluble fibers. So lots of soluble fibers are to be given to this patient. So this will be more or less her diet. And I mentioned, like, there are formulation like Menopro. You can search up. There will be many other similar compositions of like that. Sweta has joined us, I believe. Sweta, are you here? Unkita, has Sweta joined us?
Ma'am, sec. Ma'am, one sec. Let me check.
Ma'am. Okay. So Sweta, can you please give them? Yeah, Sweta, can you please give them an update on the various ice plant stenol products which are available, which can be included in this particular patient's diet? Sweta? Sweta, please give them a update on the various plant stenol. I mean, sorry, not phytoestrogen, phytoestrogen, not sorry, not plant stenol, phytoestrogen containing formulations like Menopro and the rest. Could you please give the students an update on that? later on when you take the class. Sweta, can you understand? Are you hearing? Can you?
Yes, ma'am.
Okay, fine. Then that's it with this. We go on to the next question. Question number 13. A young boy, Rahul, from the rural setting, presents with massive hematemesis. He has fever for 15 days, and clinical examination reveals 1 month back was treated with a few drugs. Clinical examination reveals moderate splenomegaly. No other history is positive. Plan his diet. Can anybody take a wild shot? Rural setting, hematemesis, fever for 15 days. Anybody can take a wild guess? Nobody? Isn't there anybody out here who's willing to take a wild guess? It's very obvious here. He's been having fever. He has
Gastric ulcer.
fever সঙ্গে gastric ulcer. অ্যানিমিয়া, তাই জন্য জ্বর হয়েছিল। অ্যানিমিয়াতে হিম্যাটোমেসিস হয়।
Ma'am, it could be hepatitis or some sort of, because maybe he has taken some non-steroidal anti-inflammatory drug for which he has got some sort of ulceration. That is
No,
all.
no, no. He has fever for 15 days and massive hematemesis rural setting. These three things should be enough to tell you. Forget 1 month was treated for a few drugs. Just forget that line. There is splenomegaly. There is splenomegaly, hepatitis. The patient probably has dengue hemorrhagic fever. Okay. Shukriya, there is lots of background news. Can you just mute yourself, please? So patient is probably having dengue fever, which means lots and lots and lots of fluid and a high protein, calorie dense diet to the patient. Remove fibers from the patient. Give first class protein to the patient. Lots of fluid to the patient. Correct the electrolyte status. In dengue, that is all that we can do from our side. We remove second class proteins, include lots of first class proteins to his diet. We try to give him calorie dense food because as it is, he'll have severe anorexia, and therefore we can only give him very small feeds. So we have to give foods which are extremely calorie dense. We'll add lots of butter to his diet. We give him things like, mashed potatoes with lots of butter in it. And we try to correct the hemodynamic status of the body, and lots of first class protein, lots of calories through calorie dense foods. You cannot give him lots of foods because the patient will probably not be in a state to eat. So lots of fluid and calorie dense food in in small amounts over a over increased frequency of feeding. You have to increase the frequency of feeding, and you have to give small calorie dense diets. Do not give too much of food, the patient won't be able to tolerate it. Am I clear so far? Am I clear? Did I say? Look that the patient is eating fully fluid, not only food, and calorie dense food. Calorie dense food. Does everybody know what is calorie dense food? You want to learn? Sit here. You want to learn dietetics? You want to learn and sit here. So what is calorie dense food? Anybody knows what is calorie dense food? Unkita, we have a new student today. Are you there, Ankita?
Yes, ma'am. Who is it?
His name is Ronoy Datta.
And he wants to learn dietetics.
Yes, he's sitting right beside me and giving me the answers, and he's being quite correct at that too.
That is great.
Yeah. So I told him to sit down here and listen to the lessons. As it is, he has nutrition this year in his school chapters. That's one entire chapter dedicated to nutrition this year.
Okay.
Okay, so anybody can tell me what is calorie dense food? You can speak loudly. Okay, Ronald feels it's food rich in calories. Out you want to see what? What do you want to see? High calorie food in small, high calories in small amount of food. Yes, that's very good. Both you and Rana gave me the answer, but what kind of food? Oh, you want to see our new student? Acha. Rana, say hi. Hello. Forget first class protein. No milkshake. Just stop talking about proteins as the source of energy. First, think about fats as a source of energy out here, because fat will give you 9 kilocalories per gram, while protein will only give you 4 kilocalories per gram. One point, and the second point being protein should not be used for energy production, rather for wear and tear. So basically, when you think about making a food calorie dense, you think about adding more MCT to it. Now, MCT is not normally available. So what we do is we can add little bit of, we keep adding butter to that food, because butter has a lot of MCT in it and medium chain triglycerides. I had given you this as an homework to tell me whether or whether not they are directly absorbed into the portal circulation. Do they have to undergo the mycelium formation, the chylomicron formation, or are they absorbed directly into the portal circulation? This is one question that I asked from you people. Today seems to be a very lackluster class. There was so much of discussion that was happening the last day. Today, nobody seems to be taking any interest. Is it because of the murkiness of the day that we have become so lacklustered today? Unsaturated fat. No, we are not talking about saturation and unsaturation. We are talking about medium chain triglycerides. Everybody seems to be very dull today. I don't know why. Am I okay? We'll do just one more question and leave it for the day. If nobody feels like studying today, I can understand certain days you don't feel like studying. But at least this question and the next, let's complete, and then I'll call it a day. Coconut oil, Shobhik, the problem is if we add coconut oil to our food, though you might find it in many of the southern authors, we don't have food with coconut oil. You won't be able to have food prepared in coconut oil. We cannot eat coconut oil. So what we can do is maybe we can give him narkol nadu. We can mince the coconut and give him narkol nadu instead. In fact, yes, butter. I've been talking about butter. We can give him narkol nadu prepared. Fluffy! Nobody seems to be in a studying mood today. Fluffy is screaming his lungs out. So, like this is it. Uh, you can give this thing. You can give narkol nadu maybe if you want to, instead of coconut oil, because the if once you're making this, scraping the coconut, you are releasing some of the oil. You're breaking the cell wall. Some of the oil is getting released, and if you're making it in, please can you close that door? So like that's it. So we can use coconut in that form and butter, as I said. This is about it that we can use for this patient. Am I clear? Any questions? I can understand it's a very dull class today. Nobody wants to participate, or I don't know, is it some kind of an holiday around? Okay, everybody's agreeing to the fact that this is a very dull class. Yeah, I understand. I can feel it myself. The vibes that are coming are very dull. Nobody wants this class to continue. Shall we continue with one more question or shall we leave it at this today? Do you want to do one more? No, ma'am. I am in a blood donation camp. No, ma'am, as in calorie requirements. Somebody is not feeling well. Calorie requirement of this is normal calorie requirement. There is no increased calorie requirement. It's a normal RDA. Only that they won't be able to meet that RDA because the patient won't be able to eat. So you have to give small foods which are calorie dense. So shall we leave it at that? Somebody's not well, somebody's at a blood donation camp, somebody doesn't feel like studying. That's okay, happens on a day. I'm not blaming you. There have been days when I've gone to my class and while my professors have been lecturing, I've been trying to find the corner of a bench and pretending to write in my copies. I've finally fallen asleep on my copy. So that's okay, I can understand. So should we do one more question for the day or should we call leave it at this only? Everybody, I'm waiting for an answer. One more, ma'am. Okay, no more question, please. One more. What should I do? Let's do it next day. One more, ma'am. Okay, most of the people says one more question. So I'll just do one more question. 40-year-old male patients with weight loss, diarrhea, weakness, fatigue, decreased appetite. He also has anemia, osteopenia, intolerance to gliadin. Here is your classic. Somebody was very keen to talk about gluten enteropathy. So this is your classic case of gluten enteropathy. What happens there? If we leave out the I'm not going into the extra abdominal symptoms. The basic abdominal symptoms is there is weight loss, there is diarrhea, there is weakness, there is fatigue, and there is despite of increased appetite, there will be all of these. There can also be bloody stool. There will be osteopenia. That means the bone mineral density is going to go low. There's going to be anemia because of the bleeding. And there will be intolerance. The moment he eats any food which contains gliadin, beta gliadin, which is a part of the gluten component of wheat, isn't it? Beta gliadin is the component of the gluten part of wheat. So this patient has to remove all kinds of gluten from the diet. And removing all kind of gluten means not only removing your atta maida, bread, and there's also removal of many kinds of things like
Barley also included in gluten.
barley does not have that much of gliadin or gluten in it. Rye will have much more amount of gluten in it, but we do not use that much of rye and barley in our diet. Instead of that, what we would want to remove would be the oats from your diet because oats also come with a quite amount of gluten, and oats is a kind of a millet that we often eat these days. So this patient
Pasta,
mostly
pasta,
has
pasta,
yeah,
ma'am,
any
pasta.
kind of wheat products. That's what I'm trying to say. Just don't think about your roti chapati. Think about all your wheat products. Even many soup thickeners come with additional gliadin. If you buy any kind of packaged food, once again, what is very important is food label reading to see if there is traces of gliadin or traces of gluten in it. Biscuits will come with gluten. You usually don't get gluten free biscuits and cookies, so that is removed from diet. So basically, one of the main problems that we encounter with such patient is there is too much of restrictions for him. So it's become the diet becomes very restrictive. Very less amount of foods can be allowed other than pure homemade Bengali diet, which consists of rice, fish, vegetables, all home cooked dal. It is very difficult for him to eat out because any kind of eating out, let's say if he's eating in the so-called Chinese restaurants, They will be making the batter with maida. Biscuits a problem for him. These pastas, pizzas, as somebody pointed out, cannot be had by him. Bakery products are a no-no for him. Most of these kinds of wafers and things like that would be a no for him. So his diet becomes very, very restrictive, and anybody with gluten enteropathy also starts showing signs of pernicious anemia. Okay. On while on that, can somebody tell me what is the factor which is associated with pernicious anemia?
Vitamin B12. Vitamin B12.
That is also known as the
Vitamin B12.
also known
Actually,
as
it is extrinsic factors which is related to
Cassell's
pernicious anemia.
intrinsic factor. Sorry, Cassell's extrinsic factor. Yeah, right. And what is the intrinsic factor?
Ma'am, it's intrinsic factor, vitamin B12 deficiency, and macro.
Macro.
Yeah.
And the R binding proteins and the R binding proteins. Okay. The R binding proteins. Please don't forget, this is a question which often comes, Cassell's intrinsic factor and the R binding proteins. Is this clear so far? So basically for this particular patient, we can try to achieve a little high calorie diet, but most of the calories once again has to come from uh, fat, not from protein, because protein should not be giving you calories. Too much of protein would end up increasing the urea creatinine level in the bodies, and for carbohydrate there is lots and lots of restrictions. We can only use the rice based carbohydrate products. Therefore we have to use, even if you want to give him noodles and things like that, is all needs to be rice based, so which is quite a challenge. We do not get so much of rice based products. Rice itself is available, so it has to be, this eating away from home habit is very dangerous for such a patient, and he is otherwise going to require all the normal RDAs for all the macro and the micronutrients, except for you know case specific case specific. Now here he has anemia, which probably means pernicious anemia, not hypochromic normocytic anemia, because there isn't any mention of iron deficiency, or there isn't any mention of melena, or also any kind of frank bleeding. What is melena, by the way?
Bleeding from the stool.
Occult blood in stool. When the stool is black in color, if it's occult blood, then the stool becomes black because the bleeding is somewhere higher up in the intestinal tract. And if there is fresh blood, which means there are chances of piles or hemorrhoids, because the stool, the blood is coming from somewhere lower down the tract after the stool is getting formed. And melena, which means black stool, which means there is occult blood in the stool, which means the bleeding is at the site where the stool is getting formed, which would in turn mean somewhere higher up in the intestinal tract. Please don't forget this difference. Melena is black stool, which is occult blood. Higher up in the intestinal tract, there is bleeding. That's why there is melena. Fresh blood in stool, which can be a sign of piles or hemorrhoids, which means that the blood is getting mixed with the stool at a site much lower or much after the stool has been formed. This is one basic difference which you need to remember. Okay. So with that, we call today's class closed. We won't discuss anything further. If there is any question pertaining to anything, you can ask me, or you can all leave the class one by one as we normally do. Have a good day.
Ma'am,
Hello, Rajni.
ma'am, can we give rice noodles and chapati made out of rice flour to this patient?
Yes, you can give anything based on rice. You can give to this patient.
Okay, ma'am. Thank you. Ma'am,
Yes.
in case of any deficiency like vitamin C or vitamin D, so the supplements are allowed to give. Can
Yes,
we?
yes, 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 yes. You have to give him in form of supplements only. At this case stage, he basically needs lots of pharmaceutical supplements. Diet itself won't be able to help him completely. Diet is going to be an adjunct therapy to him, but he needs to have medications. Thank you. That's it, then you can leave the class, students.
ম্যাম আমরা ওই ক্লিয়ার ডায়েটের নিউট্রিয়েন্টস স্প্লিট কি করে করবো এটা বুঝতে পারছি না।
কোন ডায়েটে?
ক্লিয়ার যে ডায়েট হয় না, মানে
ক্লিয়ার ফ্লুইড ডায়েট। ক্লিয়ার ফ্লুইড ডায়েট, ওটার কোনো নিউট্রিয়েন্ট ক্যালকুলেশন কিছু করাই হয় না। ওটাই শুধু দেখা হয় কতটা জল দেওয়া হচ্ছে ডিহাইড্রেশনের জন্য, আর সোডিয়াম আর পটাশিয়াম বা ক্লোরিন, জিঙ্ক, এগুলো তোমার যদি WHO দাও তার প্যাকেটের গায়ে লেখাই থাকে। ডাবের জলেরও এস্টিমেশন তুমি গোপালনে পেয়ে যাবে। এইটুকুই ওখান থেকে ক্যালকুলেট করা হয়। ওখান থেকে তোমার প্রোটিন, ফ্যাট, ক্যালোরিজ আসছে এরকম ধরেই নেওয়া হয় না। ওই হয়তো গ্লুকোজ অ্যাড করলাম 5 গ্রাম গ্লুকোজ, মানে হচ্ছে 5 × 4 20 কিলো ক্যালোরি এইরকম, বাট দ্যাট ইজ নেগলিজেবল। ক্লিয়ার ফ্লুইড ডায়েটটায় কখনোই ক্যালোরি প্রোটিনের ক্যালকুলেশনের জন্য ব্যবহার করা হয় না।
আর ম্যাম আরেকটা যেটা বলতে যাচ্ছি হচ্ছে যে আমরা যখন মানে কোনো একটা পেশেন্টের ধরুন মানে ফ্লুইড রেস্ট্রিকশন আছে, সেই ফ্লুইড রেস্ট্রিকশনের জন্য আমাদের যখন নিউট্রিয়েন্ট স্প্লিট যখন করতে হচ্ছে, বিভিন্ন ফুডে তো নানা রকমের মানে ময়েশ্চার থাকে, তো সেইগুলোকে কি ওর মধ্যে ক্যালকুলেশন করতে হবে?
না না না, ফুডের ভেতরে যে ময়েশ্চারটা থাকে আনলেস ইট ইজ গ্রসলি অনেকটা জল, যেমন ধরো তরমুজটাকে যখন তুমি ফ্লুইডটা, মানে তুমি যদি ফুল ফ্লুইড ডায়েট দিচ্ছ তো সেখানে তরমুজে অনেকটা জল, সেটা মাইট। আদারওয়াইজ অল থিংস হ্যাভ আ কনস্টিটুয়েন্ট অফ ওয়াটার হুইচ ইজ নট টেকেন ইনটু অ্যাকাউন্ট। তুমি অ্যাজ ওয়াটার, অ্যাজ পিওর ওয়াটার যেটাকে ইউজ করছো বা লিকুইড যেটাকে ইউজ করছো ওটাকেই আমরা কনসিডার করি। আদার দেন দ্যাট প্রচন্ড লিকুইড কন্টেনিং ফুড, যেমন ফর এক্সাম্পল ওয়াটারমেলন, ওটা ছাড়া কিছুই কনসিডার করা হয় না।
ওকে ম্যাম।
এবার যেখানে তোমার ফ্লুইড রেস্ট্রিকশন আছে সেখানে খুব সময় তোমার পটাশিয়াম রেস্ট্রিকশনে থাকবে, তো সেক্ষেত্রে এমনি ওয়াটারমেলন দেওয়া হবে না।
আচ্ছা আচ্ছা, ঠিক আছে। থ্যাংক ইউ ম্যাম।
Yeah, you're welcome. Please leave one by one so that I know you have no further queries. I'll wait till all of you have left.
ম্যাম একটা কোশ্চেন ছিল, মানে বলছি যদি কোনো পেশেন্টের প্রোটিন ডেফিসিয়েন্সি হয়, এজেড পেশেন্ট, তো তাকে মানে কি প্রোটিন সাপ্লিমেন্ট টাইপের কিছু দেওয়া উচিত?
হ্যাঁ, দেওয়া উচিত, কারণ তখন সে তো নর্মাল প্রোটিন তো অতটা অ্যাসিমিলেট করতে পারছে না। তাকে তুমি যে কোনো প্রোটিন, বাজার চলতি প্রচুর তোমার ওয়ে প্রোটিন,
বা ওই টাইপের
হ্যাঁ হ্যাঁ দিতেই পারো, দিতেই পারো।
ওকে, থ্যাংক ইউ।
ম্যাম কোশ্চেন নাম্বার 14 এ যদি গ্লাইডিন কম্পিটেন্ট যদি না দেওয়া থাকতো, হ্যালো,
হ্যাঁ
হ্যাঁ, গ্লাইডিন কম্পিটেন্ট যদি না দেওয়া থাকতো তাহলে এটা কিন্তু HIV পজিটিভ পেশেন্ট হতে পারতো না। মানে
আমি তো সেটা নিয়ে ভাববো না, এখানে স্পেসিফিক্যালি বলেই দিয়েছি যে গ্লাইডিন কম্পোনেন্ট অফ ফুড, তাই এটার জন্য আরো অনেক কিছু হতে পারতো। ওয়েট লস, ডায়রিয়া, ফিভার, অস্টিওপিনিয়া, অ্যানিমিয়া, অনেক কিছুর জন্য হতে পারতো। ভাই অতদূর HIV ভাববো কেন, আমি আরো তোমাকে অনেকগুলো ডিফারেন্সিয়াল ডায়াগনোসিস দিতে পারি, কিন্তু সেটা আমি এখানে স্পষ্ট বলেই দিয়েছি যে গ্লাইডিন কম্পোনেন্টে অ্যালার্জি আছে। সো প্লেন এন্ড সিম্পল গ্লুটেন এনটেরোপ্যাথি, আমি অত কিছু ভাববো কেন? Why will I unnecessarily complicate something?
ওকে ম্যাম।